Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hey, and welcome to the Unreal Results podcast. This week, I've got something special for you. Number one, we're doing two podcasts. So today, podcast drops, that's Wednesday, and then Friday will be part two. And these episodes are going to be special too because you're going to be hearing from a few of the alumni of the LTAP Level 1 courses and or the Revitalize Mentorship. I invited these professionals to come and chat and share their experiences with us, sort of looking back on why they decided to enroll in the LTAP Level 1, like what problems that they were having that they were hoping to find solutions for, or what inspired them to learn in this new lens of view. And then what's happening now that they're implementing it into their practice. What kind of results are they seeing with their patients? What are their patients saying, especially the ones that have been with them for a while, just overall sort of wanting to hear like how learning in this new paradigm, working with the LTAP, how it has helped their practice, helped their whatever it was. Like some of them will be talking about how they were burnt out at work and like kind of bored. And some of them will talk about how they felt like they were treating the whole body, but maybe they weren't considering the viscera and the nervous system. Other ones will say that they had considered the nervous system and the viscera, maybe learned from some other people, but didn't really know how to assimilate it into a more biomechanical orthopedic practice and sort of relate it back to the big picture. And it's going to be professionals that are in all different fields. So you'll hear from some physical therapists, athletic trainers, massage therapists, movement practitioners. You'll hear from some practitioners that are working only in person, hands-on, and then you'll hear from some practitioners who actually utilize this in the virtual space. So it should give you a great idea of sort of like what it looks like in practice. And the types of clients people work from are anywhere from, athletes, youth athletes, collegiate, professional athletes, to regular people that work at a desk, active aging population, the weekend warrior, scoliosis, spinal cord injury, and neurologic patients, like literally the spectrum of ages and vocations and like focuses. And so I thought it would be special to hear from somebody other than me. I also wanted to say too, before we dive in, one of the things that often comes up, especially when I teach the missing link or the results cheat code that just ended this past week, a lot of people are coming in for the first time into this ecosystem. Maybe they haven't followed me for a while, maybe they have, but like it's their first sort of like go through this new lens of view. And I always warn everyone at the beginning, like get ready, like buckle your seatbelts because we're going for a ride. We're going on an adventure that's going to sort of challenge some deeply held beliefs that you have about how the body works and challenge how you go about working with your clients. And whether you're ready for it or not, I warn people all the time and they're still sort of not ready for the sort of dissonance and the mind fuck, to be honest, that it is entering into this new paradigm. Because actually, as one of my alumni just said on the interview with her today, is like, once you see it, you can't unsee it. It's like once you're in, you're in. And there's no going backwards. Once you see this paradigm, once you really truly look at the whole organism in front of you instead of just the biomechanics, just the body, it's like, oh, we're doing this. And sometimes when that happens, people can feel really overwhelmed with the new information. Now, number one, the way I've created the courses actually, believe it or not, are trying to minimize the amount of overwhelm and minimize the dissonance involved with adopting a completely new paradigm. This is why I'm very big on practical application and taking action and just doing it, learning the techniques and going through it and implementing it with your people so you can see it for yourself. Because the whole purpose is I'm teaching you techniques in order to understand some new principles about how the body works. Then, once you understand those principles, not only can you make up your own new techniques, but now you're at a better place in your head where you can learn the deeper, like, well, why? Why did that happen? How is this connected? Then we get to really dive into the anatomy. And if I just started out with the anatomy and just started out with the theory, it would be like even more overwhelming. Because when we start out with a lot of thinking, whenever we engage our very cognitive thinking brain, it can also sort of paralyze us and support inaction, because it feels like so much information, not sure how to compute it. And so we get in this analysis paralysis type mode. And then we feel like, oh, in order to proceed, we have to understand it better. And I'm here to tell you that you don't. And it may feel a new paradigm feels very overwhelming and very scary at times. And because it sort of doesn't force you to change your treatment techniques, but change your treatment strategy. And whether you were aware of your strategy to begin with or not, it forces you to do things in a different operating system than you're used to. And that feels scary, and it can make you feel nervous in front of your patients, and nervous just like figuring it out and like, bumbling over things. But also know that it's okay, because you're not alone. Everyone goes through this little bit of a learning curve. You don't have to be nervous and scared about it too much, because that's where I come in. I've helped over the last few years, over 400 practitioners go through this course and implement the work and make it make sense and not so scary and not so hard and not with such a high barrier of cognitive dissonance. So I'm here to support you. It's not like a traditional continuing education course where you go to a class and you interact with the teacher during the class, and then once the class is done, you never talk to them again. That's not how I work. Relationships are a core value of mine. Mentoring people and sharing information and making people better is a core value of mine. And so once you're in the courses, you're in the courses. Once you're in our alumni education group, you're in it. And I am there to support you and like meet you wherever you are at. So yeah, I could talk a long time about this whole thing, but hopefully too, hearing from these alumni will help to make it feel a little bit more, well, not more, a little bit less scary, and get you very excited about being able to help your patients faster and get great results, because that's what it's all about. So I hope you enjoy it. Without further ado, let's jump in. I wanted to give everyone a chance to hear from you, how you utilize the LTAP, how it's affected your practice. And one of the requests I have in terms of you all sharing is if you can think back to what like problems you had when you found me originally, right? Like what were you hoping I could help you with? How you utilize it in your practice now? And anything else you want to share?
Oh, I'm Julie. I'm a massage therapist. I work in I'm in Southern California. Uh North County Coastal. All right. What was your question? I wrote them down.
Oh, I love it. You're
Wait,
so good,
otherwise
Julie.
I'll forget. Um, what problem was I hoping Anna could help me with when I first started working with you? So I joined the mentorship in 2021. Um, and I would say initially the first thing that really stood out to me on your website was practitioner burnout.
Mm.
Um, I was Yeah, I was really feeling that as far as like even just looking into doing something different entirely with
Mm.
my profession. And so that was that was definitely a big piece of what attracted me to you and to the Movement Rev mentorship. But then as I got into all of the modules, the learning, and then eventually the mastermind, which was really super beneficial to me and helped me so much because I wasn't quite grasping like the LTAP and that kind of thing up until that point. So doing it in person was, I mean, life changing, practice changing, everything. And
Yeah.
that has had a huge impact on my life. I happen to have ACL tear like right in the beginning of the mentorship. So having Anna help me, she worked on my knee a bit or worked on honestly other things without touching my knee. And that helped so much. And then having that be a focus in the mentorship or in the mastermind as well is like super helpful. So that was really cool to just experience it in my own body, know like what the LTAP can offer to my own clients and
Mhm.
to people dealing with issues like stiffness after surgery or I mean just pain in general. Um, it's been huge for me.
And
Uh,
just to clarify for people that might be watching, so when Julie started the mentorship, I hadn't pulled the LTAP out of the mentorship yet, so it was originally part of the modules inside the mentorship. And then, the mastermind she came to was the sort of test run or the beta run of the LTAP level 1. So, even though she's saying mastermind, it's basically the
yeah, we're
same-ish thing as the LTAP level 1 now. So, just to give you all some context on that, so
yeah.
and Julie, can you as a massage therapist, because obviously I speak to, how to use it from a more clinical standpoint whereas most of my clients have their clothes on, and I don't use sheets or draping when I'm doing manual therapy on them, so, can you speak to sort of like that unique setting and, how you even though they haven't learned the LTAP, like, they're familiar that it's 5 different tests, so kind of can you sort of and obviously they're really familiar with the first test, so how do you implement it in a normal massage session?
Yeah. So in a normal session to begin with, like close on is when I do the initial assessment. So that's before we even get on the table just to see where to start, basically. So um let's see.
And you do march test or supine? You do both, kind of.
I don't typically do march test at
Mar
all.
Okay.
I do just the supine
Supine test.
test.
The
Yeah.
supine SI joint mobility locator test, yep.
Yeah.
Mhm.
That's number one, right? Test.
Yep.
And then I from there I checked their CNS. So I usually start here and then have them turn over and I look at their sacrum. And so if that is positive, then that's where we start. So if it's positive for CNS tension pattern, then we go ahead and start there. So I'll have them start typically face up. I have been learning more like playing around with um like checking out the spine and seeing maybe we should start not in the head, you know?
Mhm.
Um that's been kind of something I've been working on lately. And then if it's not that, then I'll have them turn over again, and we look for I do the inhibition test for the viscera. Um, so I check everything there.
Mhm.
I usually use the pulses, but I sometimes use like a neck rotation if they're stiff. Um, yeah. Yesterday I actually used a just range of motion test with the shoulder,
Mhm.
which was like because all her pulses were like pretty much the same. She
Uh-huh.
had same mobility to her neck, and I'm like, like what can I do? I'm not at like super strong with muscle testing, so I was like,
Mhm.
let's check her range of motion, her shoulders. One shoulder was significantly tighter than the other one, so that was actually really cool
Yeah.
because when I went to her, descending colon, it was like I mean, it went from, like, temple level or, like, eyebrow level to, like, almost all the way back.
Great.
Didn't notice.
Yeah.
It was really cool. I was like, "Oh my god, this is amazing." I was really stoked about that. So then we would start, so that with that person, I started with the viscera, and then, from there, I usually do test a second time. So, and I have a table that lowers down so I can lean over so I'm not like getting on top of them.
Yeah.
After they've been undressed and everything. So, after once we start the treatment, they're undressed, they're under
Yeah.
that kind of thing. So then I'll do the SI joint test again. And I'll check their their head again. If it's up, I check their
Mhm.
first section, check their head, and then I'll check their sacrum. So from base up, I will either grab underneath to feel which way it's pointing,
Mhm.
or I do the nerve tension test that I learned at the Brawl Institute for
Mhm.
rights, which actually is like
Yeah.
this is really cool. So
Yeah.
that enabled me to be more clear with a second test without having to have them flip over, which
Yeah.
I just wasn't doing before. And then if it
Perfect.
takes you to the legs, then that's really easy. It goes, you just go right to the leg, and I would use the pulse again.
Yeah.
A little bit.
So, and just to go back to your when you in your treatment, so when you said you started with visceral stuff, you've not taken any of the actual visceral manipulation, right? So you're just doing general visceral massage, like that they would teach you in massage school, like gentle. Yeah. Mhm.
Or focused area, like to that area. Yeah.
Yes.
So and I think you do a good job in the mentorship of like giving like some hands-on skills that can be applied
Yeah.
to everywhere. So
Yes.
just like getting in there and feeling where the tissue is moving and following it in the direction of ease,
Mhm.
that kind of thing. Like I always remember tubes like to be stretched and rotated. So I kind of do that with something like the colon.
Mhm. Cool.
Very
And
effective.
even before you took the neural manipulation courses with the Burrell Institute, you were using this work and feeling like you got like some good responses from people's cranial stuff. Again, just with the massage tools that you use that you knew in that area of the cranium and the spine too. Yeah.
Yeah, because
Mhm.
sometimes I wouldn't even test a second time, or I would just test and just once to see where to start and just
Yeah.
begin with that, and that made a huge difference. And if it was CNS, it made it very easy to kind of like follow the steps after that.
Yeah.
Get lucky with that,
Yeah.
and so then I could test the second time because I felt a change happen, so I knew it wasn't CNS anymore. So if it still took me above the pelvis, then I knew it's viscera. So then
Yeah.
I was using it before I learned more. So, and that's another thing that I love about the LTAP in general, is that it really has helped me apply everything that I know. Like I took an ART class like I think a year or two before I took your mentorship, and I was kind of just like, okay, great. Like I just learned a whole new modality. you
Yeah.
know, it wasn't always like some things I could integrate easily, but this I just feel like with the LTAP, it's like, oh, I feel like now I can learn whatever I really am interested in learning or what I feel like would help my clients. And I have a way to apply it that gives me like a different level of confidence in learning, I guess.
Would you say, well, not even what would you say? Thank you for all that. I love to hear it. What has the feedback been from your patients? Because I know, so I see Julie and it's been a really like surreal experience, but I never saw her before she started doing the LTAP training. So I don't know sort of like how she did things before. I'm sure she got great results because it's super hard to get into her. um, but with that said, that I know a lot of your patients or a lot of your clients are people you've seen for many, many years.
Yes.
So integrating this new approach, how's that been for them?
Um, well, I think for them, it's been like, it's kind of fascinating because they just feel like they don't have to tell me what hurts, or they just kind of feel like, well, you'll just figure it out. Or um, I think at least something that I've noticed. I don't know if this has been like really intentional feedback, but I feel like it's been longer. They get longer pain relief than they used to, which I think is amazing. Or sometimes like things will just like be gone for a while before they kind of come up again,
Yeah,
which
I love that.
is pretty cool. So that's just and I don't know, like some people are like, "Oh, are you gonna still do that nerve stuff on me or whatever?" Like they'll say that, like,
Yeah.
we can keep doing that. So they do like it. And that's how I kind of hear about it. It's not always like I'm not always the best at like asking, like,
Yeah.
but I
For
would say,
sure.
I mean, I think in learning, you kind of, or I should say, in applying what you've learned, it can be a little scary from, from our side as we're like, how are they going to handle this? Are
Yeah.
they okay with like starting differently or whatever? I've had people that were like, oh, yay, I love to be assessed.
Yeah.
And then like, can I just like do a few assessments on you before we start?
Yeah.
So I think people really enjoy that you take a few extra minutes to
Mhm.
look at things, or especially in a setting that maybe like massage is not always like an assessment type of
Yeah.
setting. It's
Yeah.
like in a lot of other settings it would be, but not necessarily
For
inside.
sure. Yeah. Cool. Well, thank you for that. I really appreciate it. Um, nice. Anybody want to ask Julie any questions or both on the panel or in the Zoom? I see someone saying on the um Facebook Live that the audio is low. It's all set up right on mine, so I'm not sure why. I'm also recording this, so worst case scenario, if the Facebook recording's terrible, then I'll just upload the Zoom recording. And I also muted the people who were not talking as Julie was talking in hopes that that helped too. So, um, other than that, there's no other comments or questions. So, thanks, Julie. And who of you all would like to go next? Daniela.
I'll
Okay.
go.
Thank you.
Hey everyone, I'm Daniela. I'm a massage therapist and restorative movement practitioner, and I'm in Durham, North Carolina. And I primarily work with women that have autoimmune disease. When I first started working with Anna, I was not a hands on practitioner. I was a strength coach and doing a lot of personal training and helping my clients implement strength training into their healthcare practice. But around that time that I was getting a lot more interested in what Anna was doing, I was also learning a lot from Dr. Perry Nicholson about the lymphatic system. I was also starting to study a little bit more of Jill Miller's work and the fascia, and just had all these pieces about, or of like how a lot more things were connected than I realized. And it really made me start to ask better questions around, how are things more connected with autoimmune disease? Like, how are all these like more physical pieces connected to the immune system? And I took the results cheat code primarily just because I thought Anna was really cool and I really like a lot of her content. She shared a lot about just like visceral connections to the rest of the body. And I wanted to see if like I could have a better understanding, just to better support my clients in their strength training. But when I took the results cheat code, I was like, oh my gosh, this is amazing. And everything really is connected. And I um, signed up for the LTAP because I wanted to learn more and I wanted to have a better understanding and again to better support my clients because it just felt like there was more to what I was doing. I knew that strength training could help, in a sense, regulate the nervous system, regulate the immune system, but it just felt like that there was more ways that I could just better support my clients. And especially because with autoimmune disease, like everybody is so different and very individual and unique, and everyone's experience, even with the same diagnosis, their experience is very unique. So when I took the LTAP, like I really saw how connected everything like truly is. And I know that in the movement space, like we just really focus on the physical aspect of movement. And I wanted to just sort of like start to make those connections around how everything really ties back into the things that we don't really consider as physical, which is like the immune system and like the nervous system and people's mindsets and like the emotions that they experience and how our body holds those emotions and those experiences. So when I took the LTAP, I that is what prompted me to actually go to massage school and become a licensed hands-on practitioner because I saw that a lot of the work in the LTAP or like the assessments and the treatments could be really helpful. So, for the majority of my experience up until very recently, a lot of my experience with the LTAP has been completely hands off and has been the like using the merge test or having clients have like, do movements or have their own hand for like the inhibition tests. And it is still really cool to see like how the body communicates even when your hands are not on a client. And um, that like really motivated me to just like want to be a better student of the human body. And so I went to massage school and I got licensed so that I could. And so just recently, like this year, within the last couple months, have I like really been able to try the LTAB like with my hands on my clients and like really learn to like better listen with my hands rather than like my eyes. So, I feel really lucky because I'm like starting my career as a massage therapist with like this really cool skill set that I think is like really unique and has helped me make connections of understanding how the body works. And I think it's also has helped my clients make better connections with their own bodies and their own experience with autoimmune disease because like I feel like as much as I've done this now, like I shouldn't be surprised, but I still get like really surprised and like giddy, for lack of a better word, about how like the LTAP does like lead you to where the body wants. And more often than not, especially in like my experiences, like with practicing hands off, it leads us, like myself and my client, to like a place where the client recognizes that they are storing a lot of emotions or storing trauma or like a story about themselves or about their lives. And it really helps them have a much better understanding of their experience with autoimmune disease. Like it's almost like in there's been a couple different like cases where like my client really feels like they don't understand why they got autoimmune disease. But like with the LTAP, it has like helped them lead them to a place where it's no longer like this is this mysterious thing, but now they're at a place where they can say it makes sense. And they have a better connection to their body, and it's not my body's confused, I'm frustrated at my body, and it's more I'm a lot more understanding of my body. So, like, for me, even if, like, all the movements or hands-off, like, treatment that I do doesn't necessarily solve the issue, like, in that first session or immediately, just for my clients to have that better connection with their body and be at a place of, it makes sense, and I understand, and they have a bit more compassion with their body, and it puts them a little bit more into, like, parasympathetic and into, like, takes them away from that place of frustration and more into a place of, I can understand this. Like, that's a huge win.
Yeah, I love that. It's been fun. It's been really cool, like, seeing you transition from a hands-off to hands-on, therapist, and I think, like, one of the one of the most to at least for me, like, one of the big teaching experiences for me in my profession was when I had back surgery and I wasn't able to do physical, like, hands-on work with my clients anymore, and it forced me to get, like, so good at movement and so good at observing movement and assessing movement and, like, getting really good on my cues to, like, have the same effect of my manual therapy, and so I just love that, even though you were eager to put your hands on people, like, that's gonna serve you and your clients, like, and you already know it does, right? Like, being able to do the movement piece too, so I think that's great. Can you looking back to when you did learn the LTAP originally, um 'cause you did an online LTAP, and then you came to same mastermind Julie did that we did the LTAP as, like, the beta version in-person LTAP, right?
I did the mastermind earlier this year.
Yeah. Oh, that
Okay.
was your first one. So we had
Yeah.
one variant of it. Okay.
Okay.
Yeah. How do you feel like learning it having that experience in the mastermind more in person than online? Like, how even though at that point you were still sort of using it from a movement standpoint, like, how much did that help you sort of inform even, like, how you did it in a virtual setting or how you did it, from a movement-based standpoint?
Yeah, I think doing it in person, like, really reaffirmed that I can, like, use this hands-on skill set, because I remember when we were working with the other practitioners and we went through an LTAP assessment, like, I just so, like, out of habit immediately go to, like, what movement can we use? And it really challenged me to think a little bit bigger and, like, use, like, this new skill set of
Mhm.
having the ability to be hands-on. And I think at when we were at the mastermind, I was still nervous to use my hands because it's such a new skill. But it did feel does like it is really cool to just, like, feel how the body moves, like, when you are taking your client, like, through the different assessments, and, like, to feel that under your hands, not just with your eyes, is a completely different experience, but either way, you get the same result.
Yeah. Yeah, like, even had you not gone back to work as a, like, new, fresh massage therapist, like, having that in-person experience and getting to, like, palpate people and, like, go over the exact locations of the anatomy and, like, just be with a bunch of other people practicing it, like, would have informed your work had you gone back to what you had already been doing with people, like, either virtually or movement only.
Yeah.
Yeah.
I think, like, there were times, like, when I was not a hands-on practitioner that I was, like, worried that because I didn't have a hands-on license that I would, like, miss things,
Mhm.
or that I was, like, missing out, especially with, like, as practitioners, we get so eager about, like, "What's the treatment? What's the treatment?" Like, I felt like maybe I would miss something, but, like, having that experience in person and knowing that whether you're hands-on or hands-off, like, the LTAP leads you to the same result.
Yes.
And, like, that is, I think, the point of the LTAP is that like the assessment is the important part and being in the right part of the body is the important part. So I think that also just like helped give me confidence as a practitioner that like, okay, whether I'm hands off or hands on, like I have the skill set that I can trust. And
Yeah.
and that is one thing that you teach us and talk to us a lot about is just trusting, like trusting your assessment, trusting your eyes, trusting your hands. And so I think that experience of like, yeah, being able to be hands on and touch helped me feel confident about what I was doing before as a hands off practitioner.
Yeah. That's awesome. Thank you.
Yeah.
Appreciate that. I don't see any comments or questions necessarily directed at Daniela. So if anybody has any, please drop them or even, oh, Julie has a question. Julie raised her hand.
It's not a question, but I just wanted to, like, as you were talking, Danielle, I was like, yeah, that's really cool that you used kind of one, like the hands on to validate the hands off. And I hadn't really looked at it that way, but when, like, if I get home and Billy, who's my husband, for those of you who don't know, is if he's like hurting or something, I do the LTAP and do like gorgeous ball stuff with him because I'm tired, you know? So,
I want to massage him.
and it really works. So I just,
Yeah.
I thought that was really cool, like an interesting observation that I don't think I had really put together. It's like, yeah,
Yeah.
they validate each other, like, and so having that hands-on experience or having the in-person experience, I think just makes it
Yeah.
easier.
I
But
think it's what's cool too, and what that whole piece Daniela brought up reminds me of is like, the whole part, like the point, of me creating the LTAP was to help me arrive at the same spot that my general listening and local listening did through the, the evaluation that you learned through the Burrell Institute. And because it's so like leans into trusting what you feel in your hand so much. That's the biggest hurdle for people to get over to trusting that the body has something to tell them and like direct you. So it was like all these orthopedic sort of more solid ways to arrive at the same point. And I found through my repetition of it, like it always sort of like ended up coming to the same spot. And some of my colleagues that I've learned the Burrell Institute work through and or gone through courses with, like when I've asked them to, you know, taught them the LTAP and asked them to, do it too, they're like, yeah, it really does confirm my general listening and confirm my local listening. And so for all of you, I know some of you have started neural manipulation work with the Burrell Institute. Some of you started visceral. Some of you have done both. So it's like going to be really cool for you to have a tool to help you rapidly get used to being able to trust your hand with the general listening and the local listening. So yeah, love that. All righty, Cheryl or Megan, who wants to go next?
I'll go next. I'm Megan Teed. I am a physical therapist and Pilates instructor out of Bluffton, South Carolina. And I specialize in working with people who have scoliosis, and I have scoliosis myself. So I found Anna through her podcast, Instagram, and I was really attracted to learning from her because she was like, I can get results for my people in like 3 visits. And I was like, how do you do that?
You're like, get it the fuck out. No, you can't.
How's that possible? So I took the results sheet code and then I did the LTAP live I did the LTAP online and then I did it live in Miami in 2022.
Mhm.
And then I did the mentorship last year and the mastermind in person in 24.
Yeah.
What year are we in?
Yeah. We did the mentorship in 2023 and the mastermind in 2024. Yes.
Yeah.
Yes. And then I forgot to say it earlier, but for those of you listening on Facebook or the recording, when they say the results cheat code, it's basically what the missing link course has been. So in past rounds, it was called the results cheat code. I switched it to be called the missing link. So
Yeah.
just to clarify for people. So, okay, continue, Megan.
Yeah, so it's been really interesting for me because I work primarily with my people online. I see probably like 90% of the people I work with in a virtual capacity, 10% in person. So the cool thing with going through all of this is actually like the hands-off portion of things. That was really powerful for me to experience in person in the mastermind, just working alongside other practitioners who are other Pilates based practitioners or even personal trainers, and kind of hearing how they've been working with things. And that's been helpful for me because, I am hands off working virtually with people. And I, at the same time as I took Anna's mentorship, I was also taking Missy Bunch's mentorship. So with the LTAP virtually, and with working with people who have scoliosis, I'm really trying to delineate, is this a visceral neuro issue, or is this like a lower extremity issue? Like that's kind of how I'm separating things and parsing them out. And if it leads me more to a neuro thing, then I take people through the cranial nerve assessments that I've learned with Missy Bunch. And that's been just super cool to have like all of these tools to put together for people. And, people who have scoliosis, they tend to be very anxious, and the treatments that they've gotten in the past are very forceful and aggressive. And even like what I've learned through like scoliosis specific work is pretty aggressive. You're just trying to like force the body into a shape that it doesn't want to be in. So, learning and having all these tools makes the body more receptive to change, because when you are putting it into a position of ease, you're in a parasympathetic state, and then the change is much more easy, and the pain relief comes very quickly. So
I love
that's,
that.
yeah.
Yeah, and I love that you use the more of the functional neurology stuff from Missy for the central nervous system. And so oftentimes when I share with people like how to treat the central nervous system, it's like you can do manual therapy or you can do functional exercises for the cranial nerves, basically, or for the different areas of the cortex or the cerebellum. And that because there's always this relationship between the contents of the container and the container itself. And so it's really cool that you're using, and especially again because you're so virtual, you can't, like, even if you took craniosacral or neural manipulation, like it would not be so helpful for you because most of your patients are virtual. And so it's like having that ability to affect the contents of the container and make the function of the organ, the brain, better, then allows the container to not be in such a protective mode. And so it's really cool to know that that is how you utilize it, because I think that is sometimes like, a little bit of, especially in the virtual setting, or the hands-off setting, when we get to the central nervous system, people are like, I don't know what to do. And I always tell people, I'm like, the trigeminal nerve,
Yeah.
trigeminal nerve. That's like a big one. So it's like start there. And if that doesn't work, there's some other options, but like, and that's so related to the container. Um, but then having the other functional neurology things like the eye exercises and the cerebellar drills and things like that are such a great tool to have too. So that's cool. Nikki asked in the caption, she said, that is what I'm wondering about. I am in Marcus Shirer's class right now. and have done lots in biomechanics, red cord Pilates, and want to pull it all together. So I don't know if you're like familiar with that type of training, Megan.
That I'm not sure what you said.
Yeah, SCHREYER. Marcus, I don't know how to say that last name. Schreier. Schreier. Huh,
I'm not-
I don't know. I've not heard of them either. But it sounds like it's a lot of like, yeah, she's looking to integrate Pilates and red cord and biomechanics with this work too. Oh, he's like Missy Bunch, she said. Gotcha.
Oh,
Perfect.
cool.
Yeah. Yeah, it should work great then.
Yeah.
And yeah, should work great. And also, Megan's your person to know on Instagram, maybe make friends. She's at the scoliotherapist, right? Or just scoliotherapist?
I'm the scoliotherapist.
Yeah. Mm-hmm. So
Yeah.
that's great. How about kind of the same question for you, Megan, is is there any client, well, again, because when working with scoliosis patients, and I'm sure because I know you do like movement with them a lot too, you've probably had some clients, patients that have been with you for a while. So what have they noticed with integrating this? What have you noticed? Like,
Yeah. Um, so I've worked with people who like they vary. I have people who are in their 80s and I've been working with them for like 7 years and they're very active. That's why they want to invest in their health. And um but this one woman in particular, she is a golfer, she likes to kayak and her balance is like not great. And her pain levels are really high. And she's like, I don't know what this voodoo stuff that you've been doing with me, but like it really helps. It really works. And she like teaches her husband some stuff too. Like she'll like teach him some eye exercises and like stuff with the Coregeous ball. And so that's been really cool to see how like it's been really powerful to change her life and
Mhm.
her pain levels. And she's like teaching other people about it. So um that's like pretty consistently across the board. Like people are like, I don't know what you're doing, but like this is amazing. Like how
Yeah.
how helpful it is. And like you're just doing like these very simple things and I feel so much better. So
And now going back to like old Megan at the beginning, do you believe me that you can guarantee results in 1 to 3 visits? Yeah.
yes.
I love it. That's so good. Well, thank you for sharing all that. I think it's so awesome how you do this work, and virtual is a different beast. So, I mean,
Very grateful for
and
it.
in a client population like you work with too, it's like phenomenal. So it's cool.
It's been really powerful. So I highly recommend
Yeah.
doing all the things that Anna teaches.
Thanks. Appreciate that. Miss Cheryl, you're up.
Okay, good. Yeah, so Cheryl Ferris from Pittsburgh, Pennsylvania, and I'm a massage therapist and athletic trainer. And I found Anna, um, this goes back a while because I did her mentorship in 2020. But I wanted to do it when she first started the mentorship, which I think was 2019, right?
Yeah, I think so. Mhm.
Okay. Yeah. But I had too much going on at that time. And I was at a place where I was doing these fascial assessments, biotensegrity assessments, whatever you want to call them. And I got to a point, I'm like, nothing is coming up on these tests. Like, and it kept leading me towards the core, the head to the hips kind of a thing. And I'm like, okay, I'm missing something. And then I had a friend who's also an athletic trainer said, hey, there's this girl, check her out. And at that time, I already had like this different lens of view on the body, which was biotensegrity, not biomechanics or orthopedics per se. And I looked up Anna and I was like, wow, like-minded, like she's speaking my language. Like, I like this, cool. So that's when I did the mentorship and then did all the other things. And like what Julie said, um, the LTAP was like mixed into our
Yeah.
mentorship,
Hmm.
but it was super, super helpful to be there in person during the masterminds to get that hands-on, like little quirks and details for the LTAP because that really like fine-tuned what I was doing.
Yeah.
So that was awesome.
Yeah, you were
Um,
in the mentorship group where the assessment piece was like a 4-page tiny writing Excel spreadsheet of like every single possible assessment test I would ever do on anybody. I called it the movement map, and it was
yeah.
overwhelming. Shocker. But and you were in the mentorship group that I was like, I know I just threw like fire hose you with information, but if the only thing you pay attention to is these like 5 tests. I didn't even think I had 5 then. I think it was only like 3 or 4. I was like, these 3 or 4 locator tests. Like I think that this like I'm pretty sure this is the thing that's shifting everything for people who actually do it.
Yeah,
So,
yeah, yeah. And
yeah.
so on a total side note, doing the mentorship, I learned so much about my body. Like I'm so grateful I have those tools for the rest of my life for my own self-care. And then on another side note, when we do the movement, like your regen session online, I love going back to that every once in a while. Just like all your movement things, I'm so grateful because I have that for the rest of my life to
Yeah.
go back on and use. Um, but in terms of how I use it, it's very similar to Julie. If I have a massage client, it would be like, hey, before we get started, do you mind if I do these tests? See where we're going with things. So, for example, like a lot of massage client or massage therapists will start the person face down to start with their back. Um, but I feel like one, if we want to increase the parasympathetic state, I always start them face up and I start them on their head, neck, face, etc. before I move on. But if I did the just the SI joint test and it led me to the CNS and I confirmed it, then I'm like, okay, I know I'm spending a lot of time on the CNS, the head, what have you. Even from a Bowen work perspective, um, if it led me to the CNS, I kind of changed the order of which I do things from a Bowen work perspective.
Mhm.
So it's changed that practice too, in a good way, because I had a client, just for example, there's a language barrier
Mhm.
and it was just so cool. I was so stoked after that client. Like, there's a language barrier and it doesn't matter. Her body and my hands told me where I needed to go. And she was happy when she left. And I was like, wow, that was so cool.
Yeah, so cool.
Yeah. Yeah.
That is
Oh,
like I had that experience too in Japan or yeah, in Japan, I had Korean and Japanese baseball players to work with and no translator. And I
ugh,
got the best results because I only could listen to their body. Like I only could like let their body guide me. And man, they found a translator and they came pulled them over and to translate what is this like witch doctor? Like what how did you know I had elbow pain or neck pain or whatever? And like how did you fix it? Without me talking.
yeah. Yeah. Yeah, it's been fabulous. And even when I get to the end of the session, I'll retest the SI. And a lot of times it's like equal on both sides. They're both moving. I'm like secretly doing the yes, walking behind them, leading them out. But but yeah, the other thing too is I have a lot of lymphatic clients.
Mm.
And I feel like there's this really close relationship between the nervous system and the lymphatic system. So obviously the swelling reduction protocol has been fabulous, but I'll combine a lot of the neuro things that you have taught me with the lymphatic. And that I think is just a beautiful combination. Um, because a lot of my clientele is dealing with a lot of things. They're not just solely orthopedic. They're,
Yeah.
you know, whether it's edema or whether it's kind of autoimmune, but not like an official autoimmune diagnosis. Like there's just a lot of stuff that they're dealing with. So having
Yeah.
that neuro lymph combination is really awesome.
Yeah. I love that.
Yeah.
So cool.
Yeah. Did I miss anything?
I don't think so. Well, did you talk about what your problem? Oh no, yeah, you did, because your problem was actually I'm gonna recap everybody's problems. I mean your original problem, not your current problems. I don't know that. You were looking for more answers because the fascial testing that you did kept coming back to the center, but yet like you're like, well, what am I missing? There's got to be something else. Yeah. So, and then yeah, so I think you answered everything, because I said the original problem which led you to find me and like start learning from me, and then how you're using the LTAP in your practice. Yeah. Megan was faster results. You did it was a challenge that led you. You went to prove me wrong. I appreciate that. No. You were inspired by my clear saying I could get results so fast, and probably in your head also was like, I think actually that is possible, and maybe there's more. And then Daniela was, yeah, you had taken a lot of different people's education in these other lenses of view than traditional biomechanics, but you weren't quite sure of how it all connected, and then how it all connected back to the biomechanics and like movement in general, and um, wanted to see how it's all connected from that standpoint, but then also from this autoimmune standpoint of working with the body, not on the body. Yeah. And Julie was feeling burnout and like ready to not be massage therapist anymore, which I'm so glad you changed your mind, because she's now my massage therapist. And I'm always like, do you have any openings? Do you have any openings? So, um, going back to that burnout question, Julie, do you think now, like, part of the thing that makes you not feel burnt out anymore, at least this is how I felt when I started working from this lens of view, was because every single patient is just like so different, and like you're constantly inspired by the body and how it's connected and how things change so quickly. That's how I feel. I don't know how you feel about that.
Yeah, I was actually thinking about this yesterday. Is I'm a lot less bored.
Yeah.
Like I just feel like there's always something interesting to find.
Yeah.
And it just makes me want to be better. Like just makes me want to just get so good. Like I don't know. It's just like I just want to like yeah. It's
Yeah.
like if I get a descending colon, I want to just like work that descending colon. Let's go. It makes me excited. So
Yeah. That's cool.
yeah.
I love that. Yeah. Um, One of the comments on Instagram or on Facebook was Nikki asked, have any of you had long-term success with torn labrums or torn labrum pain on shoulders? And I'm like, yeah. I mean, yeah. Pretty much anybody who comes in with shoulder pain, they don't have shoulder pain anymore after a very few amount of sessions.
One of my first clients, can I share this?
Yeah.
Who I put the LTAP on, she had it was either a 3 or 4 year old post like surgery range of motion restriction on her labrum. The surgery is on her labrum. And she had full range of motion in the first session. And I think it was herbs point, if I remember correctly. That was like the biggest thing.
Yeah.
Then within like the magical sessions, she came in on the third session and was like, just like showed me when she walked
Yeah.
in. It was lifted. It was like she could fully,
Yeah. That's awesome.
so, and she still, I see her every once in a while. She has still maintained that range of motion.
Yeah. Yeah, and some of the that's awesome. Some of the shoulder people I've worked with, have either labral tears that haven't been repaired from like dislocations and like, you know, are doing all the things and not feeling like make much progress. And then I worked with them and they're like, "Oh, why was this so easy?" And I was like, "Yeah, because it's not from the shoulder." That's the whole reason I created that course, right? Never treat the shoulder first was like because and the key to making a happy shoulder, regardless of what kind of pathology it is usually somewhere else. Yeah. Cool. Well, that looks like all the comments, at least from the live people. Is there anything any of you want to share with me or the people that are in the missing link this week, trying to sort of like decide if they want to join the LTAP or um, either the LTAP online or in person or both?
I just want to say that I like the fact that you have the SI joint test and then you have the March test.
Mm-hmm.
Because I think the fact that you have those two tests, it encompasses a lot of people given their different um, levels of mobility in life. Um, I have older clients that can't lay flat on the table. Therefore, doing the March test,
Mm-hmm.
that's my go-to versus, having someone lie on the table. So I love the fact
Yeah.
that, and then getting to the movement piece, like what Daniela was talking about, um, just having that March test be another version of the SI joint test. I just think it gives you so much flexibility regardless of who you're working with.
Yeah. Yeah. Yeah, that is nice. And even in the in-person LTAP course, I know that, some of the participants sometimes have even tried other SI joint mobility tests that they like to use with the same principles that we use in the LTAP, and it's been great. Like Beth uses gait, and Dom, who's an athletic therapist, she uses like a side bending shear type thing. So yeah, it's really cool to have many options. So, and then the whole thing I always tell people too is like all of these tools are teaching us principles. And when you understand the principles, you get to play around with it and make up stuff. So I love that. All right. Well, also, remember these faces because these are all people who are TAs for me. So you might see them at an in-person course. Daniela is going to be in Durham. Julie will be in San Diego. I haven't talked to Cheryl and Meghan on their next locations, but they were with me in Washington, D.C. this last year. So, all right. Well, thank you. I appreciate you guys taking the time out of your Sunday to chat with me and the group, and forever grateful for you trusting me and integrating this with your clients and patients and family. And yeah,